more person.
So, yes, we're,
You
they're
good?
above us, we're here, we're paying attention to them until we, time to get up and do stuff. It's a lot more comfortable having a conversation that way than if I'm standing here like this. Why are you here? What's going on? What are you doing? Right? Talking down to them and all that. So that's the main reason why there are stools and exam tables. It's not for providers' comfort or anything like that. It's so that we can get down below their level ideally and be able to have a conversation and make them comfortable and not be hovering over them and having to approach them until it's time to do the physical exam, right? And then we're able to sit here and be able to constantly scan up and down while they're chatting, looking for things that we can visually see with our eyes, as opposed to if I'm here standing at an angle, that's a little bit more difficult. I'm missing stuff over here and whatnot. Whereas if I'm here on a stool, kind of facing them, I can, easily see anything that's skin exposed for any lesions or rashes or this, that, and the other. I can assess for JVD distension equally on both sides of the neck. Just sitting here looking straight on, I'm able to make sure that the trachea is midline. I can identify a goiter from here if I needed to. I'm looking at the sclera. I'm looking at eye movements. I'm able to see everything symmetrically as opposed to just one side and standing. Okay?
It's also one way I do it. I start sitting. I think it makes the patient feel like you're spending more time with them, even though we have, a limited amount of time. But if they start rambling on and on and on, you know what I do? I stand up.
Yeah.
I stand up, and so I can really start. I also put my hand on the door a lot, like the doorknob when I'm like, okay, it's time. Like we gotta get out of here kind of thing. Like I do some little bit of cues to try to help people wrap it up without being like, we need to wrap it up, okay?
So I don't know if how many of y'all's preceptors have utilized stools, or do they go in and intimidate folks?
All of them.
The stools.
Because they come on the computer.
Yeah, which I hate too, right? Because then you feel like you're deposing somebody on the witness stand, which is, I've been in clinics before where you have a provider who's here on the computer, I'm there as patient, and they're doing this the whole time with back literally turned, and are more focused on that than the patient, right? What you decide to do in practice, that's on you. We don't even I don't even have computers in my exam rooms for that reason. Is when I walk into an exam room, focus is solely on the patient, not on charting, not on any of that crap. That gets done after the visit. All right. I could go on and on about that. Okie dokie. So our scenario for today, we have a 30-year-old
Only 30.
white female who is presenting for her annual wellness exam, but also told the nurse at check-in there's a couple of issues that they want to talk about. Vital signs are blood pressure 112 over 70, pulse of 62, afebrile at 98, SATs 99% on room air. That's pretty much it. Even though we would consider this to be an established patient, and I know all the medical history and can look at the chart for purposes of demonstration, we'll act like I know nothing and have to kind of run through everything. Yeah. All right. So. Alrighty. Hey, good morning, how are you? I'm Brent the bald guy. Alright. So I know you're here today for your annual wellness exam, but the nurse had said that you kind of had a couple of other things going on, so we'll get to that in just a moment. But any changes in your health since last time I saw you or your last wellness checkup? No? Okay, alright. So what were the couple of things that are going on that you wanted to bring up today that the nurse mentioned?
First of all, every time I eat, I keep getting abdominal pain that lasts, I don't know, just after I eat every single time.
Okay.
And it sort of really bothers me.
All right. And what's the second thing?
My ankle. I was hiking the other day, and I don't know if I don't remember actually like injuring it, but it's been really sore ever since then. It sort of hurts to walk on it.
Okay. Which ankle is that?
It's my right ankle.
Kind of show me and point to where it's going on that.
It's sort of like here, but it doesn't really look swollen or anything, but it's just really, I don't know if this what's happened is when you turn 30, you start hurting.
That's it. Okay. Well, at least you're being consistent, you're getting everything on the right side of the body, so
Yeah.
you know, that's nice, right? All right, so let's talk about the belly stuff for a minute. You had said that it occurs after you eat. Does it seem to matter what type of food that you eat, or is this just happening all the time?
You know, like if I decide to eat healthy for a few days, it doesn't bother me as much, but you know, I like Chick-fil-A. My kids will want to go to McDonald's. That really sort of bothers me.
And how long does this last after you eat Chick-fil-A or McDonald's?
I don't know. Maybe an hour. Maybe
Would you
not.
say, we're talking sharp, stabbing, burning, cramping, something else? How would you describe it or characterize it?
More like a dull. I mean, I would say I have a really high pain tolerance. Maybe sort of a dull ache. Sometimes, like my back will hurt just a little bit
Okay.
afterwards.
All right. Scale of 1 to 10, how would you rate your dull pain?
I mean, I think at times it could even become an 8,
Okay.
but you know, it goes away, so I
Any
just
pain
blow
right
it off.
now? No. All right, great. Okay. Do you feel it anywhere else? You mentioned your back. Do you feel this pain anywhere else after you eat your McDonald's or Chick-fil-A?
Just
Any nausea with it?
yes.
Okay. Any vomiting?
No.
No.
I don't like
Any-
to throw up.
All right. Who does? Loose stools?
I mean, doesn't everybody like have GI issues? Like, you know,
Define GI issues. What do you mean by that?
where your stomach, sometimes you poop, sometimes you don't.
Okay. All right. You ever look at your poop? When your stomach's hurting you?
I mean, no, I try to get out of there.
Have you seen any blood on the toilet paper?
Sometimes.
Yeah.
hmm
Okay. How often?
I mean, probably if it's just a day that it hurt more to go poop, like it was hard.
All right. You just said you had diarrhea, so you had diarrhea and you have heart.
I mean, isn't the IBS a thing? I just figure everybody has it.
Okay. Gotta love Google. All right, fine. Take anything over the counter at all for this belly pain or your poop?
No, I don't really like to take a lot of stuff.
All right, fine. Okay. Has this ever happened before?
No, probably just within the last couple months.
All right, let's talk about your ankle. So you said you were hiking. How long ago was that again? I don't know if you actually said.
Probably maybe a couple weeks ago. We're in Hawaii.
Why? Nice. All right. Any previous ankle injuries or surgeries?
Yes, I played volleyball, so I mean, usually I can roll my ankle and it doesn't matter.
Does this feel like something you did in the past when you rolled your ankle playing volleyball?
No, I used to swell up really big.
Okay, so you didn't
Now
have any
I'm
swelling. in
sore.
this.
Mhm.
Okay, all right. Hurt just walking in general?
Yeah, sometimes, yes, like it'll just sort of be tender. Like I have to sometimes just sort of not favor, like try to put a little more weight on my left.
Okay. Has it ever like buckled and gone out on you in the last couple of weeks since you got back from Hawaii?
Sure.
Doing what?
Oh, just if I walk off a curb, you know what I mean? Like if I'm not being careful with the way I'm walking, if it's
How about like going up and down stairs, you getting out of the car?
it gets stiff going up and down stairs.
Okay, all right, fine. Taking anything over the counter for that? Any medications or tried any ice or topical creams or anything?
No, every once in a while I might take some Advil.
All right.
If it's bothering me.
Fine. Okay, so let's talk about some of your medical history. You mentioned, you used the word IBS, and then you said you've injured Any other chronic health issues?
I mean,
or
I don't
conditions?
know if I have IBS. I just figure maybe like, you know, your stomach just gets upset every once in a while.
Okay.
But I mean, I have allergies. I do shots for allergies. And
So
I
like
take-
seasonal allergies, not just like food or?
No,
Okay.
not that I know food allergies, but you know, sometimes foods hurt my stomach.
How long, maybe the Chick-fil-A and McDonald's? How long have you been doing the allergy shots?
Probably for a good over 5 years.
Okay. Any over-the-counter or prescription antihistamines or nose sprays or anything like that in addition to the shots?
I don't like to take antihistamines because they make me drowsy, so I'll do 2 nose sprays.
Which one do you know? Over-the-counter or prescription?
Well, over the counter, I guess both.
Both?
Yeah.
Know the names
So,
of them by chance?
Flonase, the brown bottle one, and then the other one's in a white bottle.
Okay.
You know which one I'm talking about?
Yeah, sure. Smells like
Doesn't
flowers.
taste good. The brown bottle one does smell like flowers, but that
Yeah.
white one, whew, it really tastes bad. But it works.
How long? Okay, alright. Okay, any other health issues that you can think of?
I mean, you know, I get migraines every once in a while, and
Okay. What are some of your triggers? And let's talk about every once in a while. The last 30 days, how many headaches have you had?
I would say when I haven't had any in 30 days, but when I do get them, they seem to come like I'll get one day, not feel good the next day, and then maybe go for a few days and get another one. They sort of come like where I'll get like 3 or 4 of them, and then I'll be good for a while.
So they come clusters, huh? Okay, interesting. Kind of point and show me when you get these headaches, where do you feel it at?
So first I can't see, and then I know if that happens I better go and take some Advil because I know I'm gonna have a really bad headache, and it's like my whole head just feels like it's gonna explode.
Okay. Any nausea associated with that? Any sensitivity to loud noises or bright lights?
The lights really bother me when I have one, but if I can know that I'm about to get one and take 4 Advil, I can still work with the headache that I get afterwards.
Okay. Let's talk about surgeries. You mentioned volleyball and sports playing and some injuries. Any surgeries in the past or any procedures that you might have had done where you didn't necessarily stay overnight? Not so.
I've had a C-section,
Okay, how many?
1.
Great. Okay. All right. Anything else?
I've had my tonsils taken out when I was a kid. I don't know what age that was.
Adenoids too, or just tonsils?
It was
taken out?
both.
Both.
Mhm.
Okay. All right. Perfect.
Yeah.
Okay. All right. We'll talk about medicines for a minute. You've said Advil several times now for your ankle and for your headaches and for other things, and you've said some Advil, and then you said 4 Advil at one point.
But that's only if I get a migraine.
That's only with the headache.
Yeah.
Okay. So on average, when you take outside of a migraine, when you take 4 of them, how many do you take at a time?
Maybe 2.
Okay. And how often? How many times a day?
Oh, not often. Just every once in a while.
Great, okay. Any other over-the-counter medications or vitamins or supplements? I know you said you really don't like taking stuff, but we
Yeah,
talked
but I
about
like to
allergy
take
medicine.
fish oil, and I take my vitamin C, and I
Okay.
take my vitamin D, and I take magnesium, and I really like those apple cider vinegar gummies.
Okay.
And then I go ahead and take some collagen because I'm getting older, so I do take my collagen. But I think that's about it.
Got it. Okay, all right. And you mentioned seasonal allergies, but you didn't say you were allergic to any medications or medical products.
Oh yeah, no, I am. So I will scratch my face off if I have to have fentanyl.
Okay.
And I one time got prescribed these eye drops for pink eye, and it made my whole face about blow up, and they had to give me steroids to help with that, but I can't exactly remember what they were, but I know I can't use Neosporin either because it'll look like it gets really inflamed. I use that.
All right. So what do you do for a living?
Do I get to pretend?
Be a rock star for all I care.
Yeah, no, I'm a volleyball coach.
Okay, all right, fine. Any alcohol use?
You know, every once in a while, maybe
Okay,
I might.
let's define every once in a while, like in the last 2 weeks.
Oh no, I haven't had any in the
No.
last week. It's just if we have like a girls' night or something, we like to have a good time.
Yeah. You Any tobacco use at all, not just cigarettes, but vaping or chewing tobacco? or
Absolutely
anything at
not.
all? No, great. Any recreational drug use at all?
Oh, no.
No?
No.
Okay, all right, fine. And let's talk about family history. Mom and dad still alive?
Yes.
Any health issues with either one of them?
My dad's had a heart attack. My mom, I mean, she's got some obesity, but otherwise, just high blood pressure, heart attack.
Grandparents still living?
No.
What did they pass from?
Both of my grandmothers, just old age.
Okay.
My grandfather had lung cancer because he smoked like 4 packs a day, and my other grandfather actually died of a heart attack at 40.
All right, fine. Have you ever seen a heart doctor or cardiologist or had a basic kind of?
No,
check
no.
up?
Every once in a while, my heart will feel weird, but that's just real rare.
Okay, fine. Brothers or sisters?
Yes, I have a sister.
Okay, any health issues with her, especially heart stuff?
No.
Okay, all right, fine. All right, well, I want to start giving you a look and listen. I'm going to ask you a few little questions probably along the way as we
Okay.
go. Certainly spend some time kind of checking out that belly and checking out that ankle, right? Anything else you can think of before we get started? No?
No.
All right, let's see what we got.
But I'm sure I'll call you if I think of something after this appointment.
How you doing that without having my phone number? Been stalking me already? I am a police officer, I'm armed. All right, big breaths. In and out through your mouth for me.
Don't you really like it when patients talk when you're trying to listen?
I don't care anymore with this amplified stethoscope. I can hear
Oh.
everything, even if they are babbling. Just hang out, relax, breathe normal for me. So you said every now and again your heart feels funny. Describe this feeling funny.
Like sometimes you know how you can feel it like in your esophagus, like 'cause it's beating, the way it beats or something. Just every once in a while. Just feels like, almost like it flutters.
Big deep breath, hold. Breathe. Big deep breath, hold. Any lightheadedness, dizziness, shortness of breath when this happens? Find yourself sweating bullets for no reason, just kind of sitting there hanging out? No? Okay. Any swelling that you ever notice in your hands or feet?
Oh, just after that trip to Hawaii, holy cow, after the plane ride, I looked like I had cankles. Like seriously, that happened.
Did you have any chest pain when that happened?
No.
No? Okay. Any fevers, chills, weight loss, weight gain?
No, but I figured it's probably coming, right? Once you hit 30, maybe closer to 40.
Alright, I'm gonna flip your thyroid for a second. Sits right here below your Adam's apple. I'm gonna put my hands around your throat. I am not trying to choke you. Don't punch me in the face. I'm just gonna have you swallow a few times. So, nice big swallow for me. Good. So I'm putting for lumps, bumps, nodules, masses, kind of like when you do your monthly self-breast exams. You do those, yeah?
Now I just fear those mammograms are fine.
So you've had a mammogram at the age of 30 already. What was that for?
Oh, because they made me do that before I could get my books.
Okay. So you got a breast augmentation.
Yeah.
That's a surgery procedure. like
Oh,
we talked about
yes,
a minute ago.
yeah.
All right, I didn't feel any nodules or masses. I'm gonna have you lay back for a moment and listen to your belly, poke around your belly here for just a minute. Tell me if there's any pain or discomfort anywhere that I touch.
Maybe a little,
A little bit up there?
yeah.
Okay, all right, we'll come back to that in a second. Push you over here for just a minute.
Is that normal?
Totally wrong. All right, so we're gonna kind of check out this little area that you were talking about up here, okay? So what I'm gonna do is on the count of 3, I'm gonna have you take a big deep breath in. You're gonna feel me kind of hook my fingers underneath this area and push down. When I let go, you're gonna blow everything out, all right? So count of 3, we're breathing in. When I let go, we're blowing out, all right?
Okay.
3, 2, 1.
That doesn't feel the greatest. I don't,
Okay. Did it make that pain worse?
yeah.
Okay. I'm gonna do it again, this time without the deep breath, all right? How'd that feel compared to the other way?
The other way hurts worse.
All right, fine. All right, sit on up for me for just a minute. Tap over your kidneys here for just a second. Any pain or discomfort with that?
No.
No? Okay, all right. I call this my silly game test. I'm not messing with you. There's a reason why I'm doing this. So, smile for me. Stick your tongue out at me. Great. Wiggle it side to side. Great. Show me 2 fists. Eyes closed, arms out, palms up. Great. Open your eyes. Squeeze my fingers. Good. Shrug your shoulders up and down. Good. Chin down to your chest. Come back up. Puff out your cheeks. Blow up like a balloon. Frown for me. Mean mug. Good. Wiggle eyebrows up and down. Great. Hear that? Hear that? Great. Feel that? Same on both sides. Push your head against my hand. Same here. Follow my finger with your eyes. Keep your head nice and still. All right. Look straight at me. Tell me when you see my fingers start to wiggle.
Wiggle,
Good.
wiggle, wiggle, wiggle.
Fingers to thumbs one by one. Go all the way down the line. Excellent. Relax this arm. Give it to me for a bit. Scoot forward just a smidge. Out getting off the table. Good. Okay, all right. I'm gonna take a look in your ears, nose, and throat for just a minute. Pretend that we did this since the light's not working. We're doing all that. We're grabbing it. This. Oh, hey, look now, Jerome. That's interesting.
No, it's off.
Yeah, no,
You have to pull it.
it's just absolutely weird. All right. Not gonna worry about that. So we've done the ENT exam. All right, I want to check out this ankle and foot for just a moment here. So, slide this off. So earlier you pointed and you said the pain and discomfort was through here, right? Okay, all right. No pain when I do this at all? No? Any pain or discomfort doing that? No?
You just feel it.
Push down on my hand like a gas pedal. Good, relax, give it to me. I'll come up. Doing okay? All right. Push in.
Yeah.
Push in against me, push out against me. Good, excellent, all right. So I want you to kind of tilt your toes down towards the ground for a second. Just kind of relax everything, give it to me here.
Yep, the inside going in.
Right through here,
Pulls
correct?
it. Mhm.
Right along through there. All right, toes just kind of straight ahead for me. All right, point your toes straight up at the sky now. Good, all right. Get that back on. All right, step down for me. See you walk, please. Good. Turn back around, come back. Gonna stop right there for me. And just like a moment ago, when I had you sitting up there and I said, close your eyes, arms out in front of you. Yep. Great. Open your eyes. Feel like you were standing still and moving around.
Good.
Perfect. Excellent. All right. Minutes.
So would you have checked her eyes too, or no?
Yeah, I said I would. I said
Yeah.
I'd do that with her.
Will they work on the next Saturday?
Yes, I'm gonna make sure that all that
Okay.
stuff's, I'll make sure all that stuff is squared away. All right?
So you wouldn't do any type of range of motion or anything like that? I mean, other than your specialized test, but nothing
She was
else?
complaining of the ankle. I saw her moving her arms while she was talking. I assessed her gait and all that stuff. I didn't have any need to assess anything else.
Are you still giving a report after that too?
No.
After.
No, I mean, I wasn't. This was me not doing it like you. This was me doing it like me, not doing it like you guys, where, yeah, you'd have a little bit of extra time because you're verbalizing everything along the way as you go, right? So probably an additional 4, 5 minutes onto that. Still way under the 30-minute time cap though, yeah? Right? So yeah, you factor in maybe 4 or 5 minutes for the verbalizing your findings as you go, and that's it. You're at 24 minutes, 23, 24 minutes. And that was doing a full H&P and pass, I mean, that was kind of running through everything, right? Some of that's gonna be given to you. So that's why I'm saying there's plenty of time on the clock for this. Plenty of time.
So hopefully that decreases anxiety because he didn't have to diagnose anything, right? He just had to say, oh, she's got a dull pain, I'm gonna look here.
She had a positive what sign on there? So she had a positive Murphy sign, so likely has a positive gallbladder. She had a positive Taylor tilt test, indicating a likely ATFL injury for her ankle. I'd be concerned about a possible blood clot because she talked about lower extremity edema after the plane flying back.
That really did happen. I had cables when we
Hawaii.
got back, and I was like, what the heck? I'm like, it went away. It was good.
So,
So
So
would you
that
recommend doing the review of systems as you're doing it to save time?
So here's the thing, right? We covered a lot of it in the HPI by me asking some questions. So stuff was covered there, and then the rest I kind of did as I went, right? So that's how I do it. Now you can do it. I would say just because again, adrenaline's gonna be up, nerves are gonna be up. Whatever way you've been doing it so far, do that for the practicum. Don't try to be like at this stage in the game with, less than a week or a week left, be like, I really like how Dr. Dorff kind of did stuff as he went along with the systems, and I'm gonna do it that way because you'll probably mess it up when it's go time. So do it whatever way you've been doing it. If you've been doing it, running through an ROS as part of your subjective on your own, sitting, talking, do it that way. Okay? Don't change at this point in time. Is what I would say. Okay? Or if you want to try and you have an opportunity to get lots of reps between now and then, okay, whatever. But
I've been trying it both ways, but I've been running out of time, so that's the reason why. But I've been adding on stuff that you didn't include, so that should help.
got it. All right. What else?
So you see, you're not doing every musculoskeletal test, right? You just have to know them all.
Yeah.
Because if they come in with back pain or, you know what I mean? So that should help.
And there wasn't a lot of up, down, right? We clustered everything at whatever level she was at or whatever position that she was in at that time. Right?
She came in for an annual, but
Yep.
you didn't do like a comprehensive.
She added on a bunch of other stuff. Oh,
Okay.
no, I did a comprehensive, that was a full head of them.
Mhm.
We talked about past medical history, past surgical history, social history, meds, family
Okay,
history.
okay, yeah.
Health maintenance in terms of, screening for breast cancer and,
Yeah.
Are we gonna be counted off if we know how to perform the test, but we can't remember the names of those tests specifically?
that's what your sheet's for.
Okay.
That's when you step away and say, let me check something real quick, right? And you walk over and take a look and go, yep, okay, so she has a positive Murphy sign. Right? You're going, doing this, and she's saying it hurts. I can't remember the name of this test right now. McMurray's, no, wait, that's something else. That's the knee. Hang on a second. Let me check you real quick. Murphy's. Murphy. She has positive Murphy sign. Right. So if you don't know, don't blurt something out. Because if you go, she's got tenderness over McBurney's point, and you're up here, and you just did Murphy's, we're gonna be like, nope. Right. So if you don't know, don't just blurt crap out. Stop, take a look at your sheet, come back. She's got a positive.
Birthday
Gotcha.
is 10/13/96.
So
Tadisha,
that's
T-A-D-E-A-H.
plenty of time for a full head to toe.
Last name Turner.
So if you just have 3 or 4 systems to do,
The augmented
you're
75
doing
kilograms
that in a
twice
fraction
a
of
day
time.
for 10
Right.
days, number
Trust
20
me,
with no
you will
refill.
not run out. If you run out of time,
You need anything else?
you were either doing way too much or there was a lot of,
Yes,
so,
thank you.
okay,
Okay, bye-bye.
but plenty. Right? It's just organization. And then the verbalization, using the proper medical terminology. So, you guys can all do this. Yeah.
Breathe a little bit.
And then this stuff will be set up here. You'll have tongue depressors, reflex hammers, tuning forks, pen lights, cotton tip swabs. Oh, they do actually have sterile charts here. You'll have something on the overbed head table. Just because there's crap on the table doesn't mean that you have to use it all, by the way. It's gonna be specific to the scenario. So you may utilize all that stuff, you may not even have to touch any of it. Okay? That'll be dependent on scenario, but there'll be stuff there, and then I'll make sure that they correct these wonky little things. I've got portable ones in my clinic that I may bring up just as backup in case they don't get that done.
Well, also, could you show us how to use one of those too?
If it'll work.
The one next door is working, the one.
Well, here, we'll let our ENT resident expert.
She already told me she didn't know how to use
The
it.
hot
Demonstrate
dog
that.
fountain.
I'll show that one. You can do the Otis.
I know how to use the other ones, I just don't know how to use that.
Oh,
they wanna
just,
know how
the
to
Panoptic?
Yeah,
Yeah.
I just don't.
You can just, is that one like that over there, or is it an opt-down?
It's different.
No, it's not done.
I played
Well,
with the
we
other
can
ones.
take this off, I think, and put it over there. Take off the
Let's try
top,
that.
take off the top.
Maybe I could,
That's the weirdest freaking thing.
I know.
I ain't gonna lie.
That's so damn weird.
Power, it does.
So you said these over here work?
Ask me something.